Benzo addiction is one of the most misunderstood and dangerous forms of substance dependence affecting men today. Because benzodiazepines are often prescribed by doctors, many men don't realize they are becoming addicted until stopping feels impossible. This video is here to explain what makes benzo addiction different, what to expect if benzodiazepines have become a problem, and what real recovery requires for men. My name is Chris Burwash. I'm the founder and CEO of Into Action, and I'm also a man in long-term recovery. I've lived the reality of addiction, and I built Into Action to address substances like benzos honestly and correctly, without shortcuts and without minimizing the risks. Benzodiazepines affect the brain differently than most other substances. Medications like Xanax, Ativan, Klonopin, and Valium slow the nervous system and suppress anxiety. Over time, the brain adapts to their presence. What often starts as legitimate use for anxiety, sleep, or panic can quietly turn into dependence. For many men, benzo addiction doesn't look chaotic at first. Men may still be working, parenting, and functioning outwardly. Internally, however, reliance builds, doses increase. Mixing benzos with alcohol becomes more common. Anxiety worsens between doses, memory, motivation, and emotional stability begin to erode. Warning signs of benzodiazepine addiction often show up subtly. Behavioral signs can include strict control over medication supply, anxiety when doses are missed, visiting multiple prescribers, or using benzos to cope with everyday stress. Men may withdraw socially, become emotionally flat, or rely on benzos to sleep or function normally. Physical symptoms of benzo addiction can include fatigue, poor coordination, memory issues, headaches, and digestive problems. Emotionally and psychologically, men may experience increased anxiety, depression, irritability, panic, or emotional numbness. These symptoms often confuse men because they feel like the original anxiety is returning, when in reality, dependence is driving the cycle. Benzo withdrawal is one of the most important reasons professional treatment matters. Unlike many substances, benzodiazepine withdrawal can be severe and prolonged. Common benzo withdrawal symptoms include intense anxiety, insomnia, tremors, muscle tension, sensory sensitivity, confusion, and strong cravings. In some cases, withdrawal can involve seizures or serious neurological distress. Because of these risks, stopping benzos abruptly or attempting to detox alone is not recommended. Withdrawal symptoms often become overwhelming, pushing men back to use simply to function. This reinforces dependence and makes recovery harder without structured, medically informed support. Long-term benzodiazepine use also carries serious risks. Benzo addiction can impair memory, emotional regulation, decision-making, and overall mental health. It increases the risk of accidents, depression, and overdose, especially when combined with alcohol or other substances. Over time, many men feel disconnected from themselves and the people around them. Benzo addiction requires a structured, disciplined approach to recovery. At Into Action, we work with men who are ready to stop managing symptoms and start addressing the underlying patterns driving dependence. Structure, accountability, and consistency are crucial because benzo addiction thrives in avoidance and fear-based coping. Into Action Recovery in Phoenix, Arizona provides benzodiazepine addiction treatment designed specifically for men. Our approach combines evidence-based clinical care, careful stabilization, 12-step integration, physical restoration, and a men-only recovery environment. Clinically, we use therapies such as cognitive behavioral therapy, trauma-informed care, motivational interviewing, and relapse prevention to address both dependence and anxiety patterns. The 12-step component of our benzo addiction treatment is non-religious and focused on honesty, responsibility, and internal change. Men learn how to rebuild trust in themselves, tolerate discomfort, and respond to anxiety without relying on substances. Physical health and routine are also essential in benzodiazepine recovery. Long-term benzo use disrupts sleep, energy, and nervous system balance. Through structured schedules, physical conditioning, nutrition, and consistent habits, men begin restoring stability and confidence. Recovery here is active and intentional. Brotherhood plays a major role in benzo addiction treatment at Into Action. Men recover alongside other men who understand the fear, dependency, and frustration tied to benzodiazepine addiction. This is not a passive support system. It is a community built on accountability, honesty, and shared responsibility. Recovery from benzo addiction is not quick, but it is possible. At Into Action, we focus from the beginning on long-term recovery. Transition planning, continued accountability, and ongoing connection help men maintain progress after treatment. Benzodiazepine addiction does not have to define your future. With the right structure, support, and commitment, men can recover and stay recovered. If you recognize yourself or someone you love in this description, Into Action is here to help. Our benzo addiction treatment program in Phoenix, Arizona is built for men who are ready to take responsibility and change. So get into action today and give us a call.